Body mechanics refers to the way we move during everyday activities. Good body mechanics may be able to prevent or correct problems with posture and also protect your body, especially your back. Correct posture when standing. Wear shoes. They protect your feet from injury, give you a firm foundation, and keep you from slipping. Keep your feet flat on the floor, separate about 12 inches, and keep your back straight. Walking. Keep your back straight as you walk. If helping a patient to walk, you may need one arm around the back of the person. Put the arm at the side back or ready to help the person if needed. An object. Your feet should be 8 to 10 inches apart, a standing position. Keep your back straight. Lower your body to get close to the object. Bend from your hips and knees. Do not bend at the waist. Hold the object by putting your hands around it. Keep your knees bent and your back straight. Lift the object using your arm and leg muscles. Do not use your back muscles. When turning, rotate your whole body, not just your back. Remember, if the object is too heavy, ask another person to help you.
Body alignment. Body alignment and positioning the patient is maintained by moving, turning, and positioning the patient in a manner that helps the patient feel more comfortable. Body mechanics for the patient. Although the patient is probably not doing any lifting, good posture should not be neglected.
Lower the side rail nearest to you. Cross the forearm over the patient's chest. Bend the near arm at the elbow, bringing the hand toward the head of the bed. Have the patient bend his knees if able. Cross the near leg over the other leg at the ankles. Roll the patient slowly and carefully away from you. Place a pillow for support behind the back. Make sure the patient's body is in good alignment.
Patient safety. Patient safety is the number one priority for a healthcare professional. Safety during patient care and procedure should be taken into consideration.
Identifying the patient's name. Make sure that the bed rails are always up to maintain the patient's safety. Reposition the patient every 2 hours to prevent pressure ulcers.
Body mechanics while repositioning the patient. Body alignment means a position in which the body can properly function. It is maintained by moving, turning, and positioning the patient in a manner that helps the patient feel more comfortable, relieves strain, helps the body function more efficiently, and prevents complications like contractures and pressure ulcers. After you have turned and moved the patient into proper body alignment, you can place pillows and other supportive devices to help the patient maintain the position.
Response to basic emergency. What is an emergency? Emergency is any unexpected situation that requires immediate action and attention.
Breaking news. A famous ramp model was hit by a stroller this morning due to a mother's carelessness.
Oh my god! Ow! I'm bleeding! Are you okay? Are you okay? What happened?
Bleeding. Identify the area that is bleeding.
Where is it? Where is it?
Have the victim apply continuous pressure over the bleeding area if able.
Okay, hold tight in here.
If it's possible, call for help.
Okay, hold on. Help! 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 Oh, nobody's helping me. Hold on, I need to call 911. Hello?
Fainting. When the blood supply to the brain is reduced for a short time, the person loses consciousness. Help the patient assume a protected position, sitting or lying down. Loosen tight clothing. Position head lower than heart to encourage cerebral blood flow. Allow person to rest for at least 10 minutes.
Are you okay? Yes. Get up now. I'm gonna check your pulse.
Maintain the patient's normal body temperature. If needed, call for additional help. Monitor the patient's pulse, respirations, and blood pressure.
What's happening? What's happening? Are you okay?
Heart attack. Immediately signal for help.
Hello, 911?
Stay with the patient. Have the patient stop any activity and assume a comfortable position. Help keep the patient calm. Elevate the head to assist breathing. Provide oxygen if available.
Breaking news. A disease outbreak is spreading throughout the facility. Hand washing, wearing protective personal equipment, and standard precautions are mandatory to all healthcare personnel.
Always wear clean gloves before touching mucous membranes and non-intact skin. Change gloves between tasks and procedures on the same patient after contact with material that may contain high concentrations of microorganisms. Remove gloves promptly after use before touching non-contaminated items and environmental surfaces and before going to another patient. And wash hands immediately to avoid transfer of microorganisms to other patients or environments.
Hand washing. Hand washing is the #1 key to prevent infection and the spread of diseases. First, remove any jewelry that could be the reservoir of pathogens. Turn on lukewarm water. Wet both hands. Make sure that the fingertips are facing downwards. Get enough hand soap and make a lather. Make sure that your clothes is not touching the sink. Rub your hands together, then start on the wrist. Then go around your digits. Rub your nails on your palm. Rinse your hands starting from wrist down to your fingers. Do not rub them together. Get some paper towels and pat dry your hands. Then get another paper towel to turn off the sink.
Removing contaminated gloves. With the fingers of one glove, grasp the cup or palm of glove on the other hand. Pull the cuff of the glove down over the hand and fingers and remove it. Hold the glove just removed in the gloved hand. Insert fingers of the ungloved hand inside the cuff of the other glove. Pull the glove down over the hand and then pull both gloves off, holding the inside. Then discard the gloves in a proper container.
Wear a mask and eye protection or face shield. Protect mucous membranes of the eyes, nose, and mouth during procedures and patient care activities that are likely to generate splashes or sprays of blood, body fluids, secretions, or excretions. Contaminated gowns should be removed properly. Undo the waist tie, then the necktie, and loosen the gown at shoulders.
Edit ko na lang yan. Lahat naman yung pag-shoot natin have to edit it.
Slip fingers on your dominant hand inside the cuff of the other hand without touching the outside of the gown. Pull the gown down using the gown-covered hand, then off both arms. Fold the gown away from the body and dispose in the appropriate receptacle.
Bath blanket or mattress. Oh my goodness.
Grasp the cup of
We don't have my purse. Sorry, purse. Here you go.
Purse. Sorry, purse.
What did I just write? Action and attention. I messed up.
May video sa